Greetings to you all. My name is Eder Pedroso. I am a dental hygiene student at New York City College of Technology. In June 1845, James Marion Sims, a 33-year-old surgeon in Montgomery, Alabama, was called to the bedside of a pregnant black teenager at a nearby plantation. According to Sims, the patient, named Anarcha, had been in labor for an excruciating 72 hours. The baby was wedged in her pelvis, her contractions had almost ceased, and if nothing was done, both would die. Sims, who would go on to be regarded as the father of modern gynecology and one of the most highly recognized doctors in America, by the time of his death in 1883, wrote that he pulled the infant who did not survive out with forceps, but the girl's vaginal canal had already been seriously injured from relentless pressure of the baby's body, and days later, dead tissue began to slough off, leaving two openings, one the exposed bladder and the other one the rectum. The injury Anarcha suffered during childbirth is called vesico-vaginal fistula, a devastating condition that is rare today in wealthy countries, but was not uncommon in the 1800s before the advent of modern anesthesia and advancements in cesarean sections. During that time, it more often struck enslaved black women due to the malnourishment and pregnancies at a young age. Sim was single-mindedly obsessed with curing the affliction and spent several years perfecting his techniques with repeated surgeries on at least 7 other black enslaved women and teenagers that he housed in a small hospital he had built behind his own home. Fistulas took over everything from their sufferers who bore great pain. Sim was seeking honor as the man who could cure fistula all for once. For nearly 4 years, Sims carried out these operations without anesthesia, although ether anesthesia was first demonstrated 10 months into his work. Many doctors were slow to adopt it, wary of overdosing or underdosing. During this time, he invented a version of the speculum, pioneered the use of silver sutures to prevent infection, and designed slender perforated lead bars to serve as clamps, along with an S-shaped silver catheter with slits and holes that drained the bladder, which allowed sutures to better heal after fistula surgery. His early experiments were awful failures, leading to infection and even sepsis. And though later surgeries slowly shrank the fistula's size, these improvements offered hope but little clinical reprieve, since urine can flow easily through small openings. In 1849, he claimed to have finally succeeded in closing Anarcha's fistula. It was her 30th surgery and the beginning of Sims' ascent to fame, leading to his eventual founding of the first hospital for women in New York City, culminating in his election in 1876 to president of the American Medical Association. Lucy, another one of his test subjects, had surgery done that were unsuccessful, and it nearly killed her with severe blood poisoning. He nonetheless continued to perform procedures on enslaved women, sometimes drugging them so that they could not resist or move. Unable to refuse treatment or withhold consent, Lucy, Anarcha, and Sims' other enslaved patients were powerless to protect themselves from medical exploitation. During and after enslavement, physicians often denied black people basic dignity and personhood through mistreatment that reflected the prevailing and dehumanizing myth that black people were less sensitive to pain than white people. That's very unfortunate. Sims was celebrated for his medical achievements. His statue remains on the Alabama State Capitol grounds today. But increasingly, his brutal mistreatment of black women is informing a broader understanding of his legacy as an especially cruel chapter in our history of racial injustice. In April 2018, a Sims statue was removed from New York City Central Park. It is important for us to uphold ethical practices in the medical field. It is paramount to ensuring patients' well-being, fostering trust between healthcare providers and patients. This maintains the integrity of the profession by prioritizing patient autonomy, respecting their dignity, and making decisions that are always in their best interests, even when faced with complex situations. This ultimately leads to a more responsible and reliable healthcare system for everyone. Thank you for your time.